The Flint Health Initiative is a patient-centered, community-focused wellness model that aims to bring integrative medicine to underserved communities and BIPOC populations. Hi, I'm Dr. Jacquelyn Burrell, and I'm a naturopathic doctor. I work with underserved communities in Flint, Michigan, and in an integrative medicine clinic in Burlington, Vermont. As physicians, we're really in a position of power and a position of privilege, and I think it's imperative to identify areas in which we can continue to serve different communities. This health initiative is unique because we're partnering with the patient's PCP in order to bring integrative naturopathic and functional medicine to the individual. We're empowering them through education, and we're also partnering with community leaders and local projects in order to really bring this wellness model to the community as a whole. One of the goals of the project is to bring the healing knowledge of environmental medicine to underserved communities and to really empower the patient to take charge of their own health through knowledge. We chose Flint, Michigan because my mentor and colleague, Dr. Pizzorno, has medical doctors there that he's worked with before. One goal, and I think one important piece of working in underserved communities, is to find places that you have a connection. It's extremely difficult to come into a community where you don't have any connection to any local community leaders. You need to have that foundation in order to have a successful program. Not only do we have medical doctors on the ground working with patients, we also have local primary care providers providing patients for our project, and we have local community organizers and leaders who are in support of the project. When we all work together, we can really have a collaborative effort that really works. We've all heard about Flint, Michigan and the toxic lead in the water supply. However, lead's not the only issue. There's plenty of other environmental toxins that we really need to identify and remove in order to create the conditions for health. And again, Flint, Michigan's not unique. There's many other communities facing these same problems. When we identify the environmental toxins, we can correlate these with chronic disease and help to fight and reverse these diseases. When we remove this toxic burden, we reduce the incidence of chronic disease. There's clearly the importance of working integratively with local community leaders, but there's also a need to work with broader companies such as Fullscript, which provides high-quality, evidence-based supplementation to our patients. They also provide direct-to-patient shipping, which just aids in the process of the healing that we're trying to do. We also need resources such as providing that direct patient care with the medical doctors on the ground and providing a physical location to do things such as lab collection and lab testing. The goal of this project is to bring integrative medicine to underserved communities already experiencing high levels of toxic burden and health inequities. As physicians, we like to look at what are the obstacles to cure for an individual patient. We need to look at a societal level for these patients. The health of your community affects the individual. When we reduce the toxic burden, not only for things like prenatal medicine, we're changing the trajectory of the community going forward. And as integrative practitioners, it's our responsibility to look deeper into the patient's problems.